Hello friends, we are starting with a new chapter that is screening of diseases, and today we are learning about the concept of screening. In this lecture, we will learn about what is screening, what is lead time and criteria for screening. With this, let us begin the session. So what is screening and why it is important? Screening can be used to prevent diseases. It can be used to control the diseases for research purposes and also to create public awareness. So, screening is defined as the search for unrecognized diseases or defect by means of rapidly applied test, examination, or other procedures in an apparently healthy individual. Screening should be done only for those diseases where there is a considerable time lag between the disease onset and the usual time of diagnosis. Between the onset of disease and the usual time of diagnosis, there are several critical points which determine the severity of the disease and the success of the treatment in reversing the disease process. Now you can see a timeline of disease from its onset to the first possible point of detection and then the usual time of diagnosis and finally the outcome. A screening test will detect the disease between the time period B and C, whereas the usual time of diagnosis is at period D. Thus, by screening, there is a gain in time period between point B and D, which is called as the lead time. So, lead time is the advantage gain as a result of screening. So, now we have understood what is screening and what is lead time. Let us now see what is the criteria for screening. The criteria for screening are based on two considerations: criteria related to disease and criteria related to the test. So the criteria for disease to be screened are: the disease should be of public health importance, it should have recognizable early stage, the natural history of the disease or the condition should be known, it should have a test by which disease can be diagnosed before the onset of signs and symptoms. There must be facilities available to confirm the diagnosis. There should be guidelines as to who is to be considered as patient, that is, cutoff levels or findings that are suggestive of disease status should be defined. There must be effective treatment. Early detection and treatment should reduce the morbidity and mortality. The benefits of early detection should exceed the risk and cost. Now let us see what is the criteria for screening test. Now the test should fulfill the criteria of acceptability, repeatability and validity. Now what is acceptability? The test should be acceptable for people so that they can cooperate. If the test is painful, embarrassing, causes discomfort, people will not cooperate. For example, injections or per rectal or per vaginal examination. The second thing is repeatability. The test should be reliable or repeatable or reproducible. That is, when the test is repeated in the same individual under same conditions, it should give consistent results. So it depends on three important factors. First is observer variation, second is biological or subject variation, and third is error due to technical methods. So first is observer variation, in which there could be intra-observer variation or could be inter-observer variation. Intra-observer variation, it is a variation observed in a test result when the same observer applies the test on the same individual at the same time under identical conditions. For example, recording different results of peripheral smear by same observer on the same slide on 2 different days. So this can be overcome by training. Second is inter-observer variation. It is the variation observed in test results when two or more observer applies the same test on one individual under identical condition. For example, if one lab technician finds the tubercle bacilli in the sputum smear while other finds it's normal, it can be overcome by standardization of the procedure and intensive training. The second variation is biological or subject variation. It is the variation observed in the test results in the same individual under identical condition. Example, variation in the pulse rate or respiratory rate at morning or evening, variation in the answer given by the subject due to difficulty in recollection of past events or give socially culturally acceptable answers. There could be errors due to technical methods. It is the variation observed in a test result due to defect in machine or procedure, calibration not done correctly, faulty reagents, or the test itself may be inappropriate or unreliable. So it can be overcome by calibration of the equipments. Third is validity. Validity means the ability of a test to correctly identify those with disease and those without disease. For example, oral glucose tolerance test is more valid than urine for sugar. Now this has two components, sensitivity and specificity. Sensitivity is also the true positive rate. It is the ability of test to correctly identify those with the disease. Specificity is the true negative rate. It is the ability of test to correctly identify those not having the disease. So with this we have come to an end of this lecture. If you found this video helpful, like it, share it and subscribe for more.